Hello, my name is Dr. Robert Yoho, and this little segment is about breast lifts. My take on breast lifts is that generally the best breast lift is the ice cream cone approach, or in the medical jargon, the leisure mastopexy or the vertical mastopexy. Now, this doesn't involve generally putting a scar underneath the breast. It's just a scar down the front, which would be kind of underneath, ending up, and a scar around the areolas, which generally do very well because they're so carefully measured. I marked my sternal notch so you have an idea of where it is. So you'll have an idea of how we measure these things. And we measure from the sternal notch to the nipple. Now, once vertical mastopexies have been done with as much as 38 centimeters from the sternal notch to the nipple, which is too much. You know, generally they're a lot less than that. 38 centimeters, we may consider you for some other kind of approach. But it just gives you an idea of where your nipple is going to end up if you think of this nipple being ending up right at the crease underneath your breast. That would be where the nipple is, and then the areola would extend in a circle around that. So we like this kind of breast lift a lot because there's the scarring or the suturing is done underneath, and this underneath suturing produces a kind of a lift that will preserve the shape of the breast for years to come. It doesn't leave a weakness there. Another issue I'd like to discuss is whether or not you do the implant at the same time as the lift. We think this is not a smart move. The implant tends to push out on the stitches and cause troubles, and the stitches are trying to hold in a newly surgical breast. And it's been written up in the medical journals and so on that the breast lift in association with the implant placement has as much as a 50% problem rate. In other words, 50% of them come to another surgery or two, which you don't want. The vertical mastopexy is a pretty reliable procedure. There are some problems. You should not expect the surgery to be over the day of the procedure. You know, we may need a little tune-up later, but it's not anything like putting an implant in at the same time, which we don't do. And we think over half the surgeons have decided against it, from everything I can tell. So look at dryoho.com for examples of my work. And remember, those breasts are sisters, not twins. A little bit of asymmetry with a nipple slightly higher than the other, that's not a disaster, that's just a normal breast. So the overall shape is what we're trying for, and an overall nice aesthetic look. We can preserve all of your breast tissue, or just about all of your breast tissue, when we fold it to make this breast look like a normal breast instead of a saggy breast. So if you need a larger breast, we can certainly put those implants in, but we do need to wait 4 to 6 months, preferably a little bit on the longer side, to let all that circulation work and you know, make sure that we don't have a problem later on down the line. So thank you very much.